Hi, I'm Sharon Weinstein, a registered nurse and president and founder of the Global Education Development Institute. The Global Education Development Institute works to educate emerging healthcare leaders in developing nations. We're an educational provider, and we're delighted to be able to share some of our educational programs with you. This first module is known as Preparing for International Collaboration. And for those of you who may have taken international trips or have collaborated on various issues with colleagues abroad, I'm sure that we'll cover some points that will hit home for you. But these are critical points and critical competencies that must be acquired in order to establish and maintain successful international collaboration and successful international partnerships. The process, first of all, is one that is very, very near and dear to nursing. It involves what is known to you: assessment, planning, actions, and outcomes. So if you use those 4 key parameters when starting to plan your travel or arrange for your participation in an international collaborative project, you'll certainly be much more successful. There are tremendous opportunities that are available for nurses in the area of international health. These programs support much needed healthcare services in health education, in nutrition and hygiene, in a multitude of settings from hospital to outpatient to remote clinics, and of course for cultural exchanges. The core concepts associated with travel involve such things, and they're basics: a passport, visas, being aware of the requirements for travel before planning your trip, any immunizations that might be necessary, emergency interventions, how will, in fact, if you have some unforeseen incident abroad, you access the appropriate healthcare system for yourself. Translation needs, dress code, and we know that dress codes vary from one country to another. What is appropriate at home might not be appropriate abroad. Being observant and aware of, cognizant of, the national holidays that folks are celebrating, so that in fact you're not planning activities on days that are national holidays in those countries. Culture, any side trips that you might want to make, packing, and we always recommend packing lightly, gift giving, ceremonies, and in-country transit. All of these are key concerns. Nothing is more rewarding, however, personally and professionally, than international collaboration. And as I said, preparing for your trip will make that opportunity much more successful. So when you prepare for trips, what do? If you're affiliated with a university, you might contact the university. Perhaps they have resources. Travel agents are helpful. Right now, online resources are readily available to you. Peer resources, working with other members of the faculty or of your institution who have either hosted delegations or who know individuals who have worked abroad, might also be good resources. Existing professional societies, such as nursing associations from other countries, and of course the Global Education Development Institute. So what do you bring on your trip? We mentioned packing lightly. You want to bring gifts for your colleagues, and those gifts should come from and be native to your own country. The worst thing that you could possibly do, for example, is to visit the People's Republic of China and bring gifts that you picked up in Houston that say made in China. So you do want to be sensitive to the fact that whatever gift you give does represent the country that you come from. Making sure that you bring and maintain a daily journal will provide evidence of your travels and your experiences later on, and you'll truly enjoy reviewing them yourself and with your colleagues. Business cards, a small first aid kit, medications if you need them. It's always nice to share photos of you and your place of work with your family, your work site. You should also always bring a copy of your passport and 2 additional photos, so that in the event that something does happen to your passport, you at least have the resources to have a copy of that and have a new one developed, and also to create a new visa should it be necessary. And of course you should have a camera, and you should have envelopes for receipts and some of your other, you should have envelopes to maintain your receipts. Communication is critical. No matter what country you're traveling to, you should learn some basic greetings in the native language. You should be aware of the eating methods. You should be aware of rituals. And it's always good, even when you're working, think about it in terms of the foreign patients with whom you've dealt. If you didn't speak the language that the patient was speaking or that was native to that patient, you could use hand signals, you could use photo boards, and the same thing is possible within the scope of professional international collaboration. Make sure, however, that you maintain some sense of balance within your travel. Don't plan your days for 24/7. Make sure that you have 6-hour work days so that you do have time to take advantage of the cultural opportunities that are available to you, spontaneous and organized activities, leisure activities, certainly cultural experiences, and be sure to allow less structure than you would normally have in your normal work day, because you do also have the challenges of working in a country that is in fact foreign to you. Whenever possible, see if you can arrange to have a homestay. Nothing is ever more rewarding than taking the time to stay with a family, getting to know their local customs and cultures, getting to know who they are and what they do and what's important to them, and why, in fact, it would be important for you to reciprocate and invite them perhaps to stay with your family during a visit that might occur with that particular individual and your own home country. When you plan your activities, you should have professional activities and you should have personal activities. Those professional activities might take place in hospitals and health clinics, in colleges of nursing, or even within the nursing association. Personal activities might be museums or cultural sites, but at all times make sure that you allow some time for fun. The rewards of international partnerships are unbelievable. You create long-term relationships. There's social and professional networking opportunities, the opportunity for future exchanges, and for cross-cultural collaboration. So nothing is out of reach. There are so many incredible opportunities for you to do amazing things and to use this as a stepping stone for your future, both personally and professionally. Follow-up activities are critical. It's important to plan future collaboration. Each step of the way and each site that you visit, you should exchange business cards. You should arrange with that individual to follow up through electronic mail, through the internet, or whatever means is available to you, so that you too can in fact maintain that flow of information, pick up on the pieces that were promised in terms of deliverables from your trip, and be sure that you are in fact continuing that chain of communication. Journaling again, trip reports, email exchanges, and of course, thank you notes to all those who have been involved in your particular trip. There are tremendous transitions that take place as a result of international collaboration. Life-changing experiences are detailed in the book Nursing Without Borders, which was published through the Global Education Development Institute and really details success stories that have occurred related to international travel and international partnerships. Each of these stories is a story that must be told. We provide expertise through GEDI to individuals, to groups, to organizations, and to communities in need. Needs assessment, program planning, and implementation and outcomes evaluation. So we want to be sure that you document the successes of your collaboration so that you too have a story that can be told. An important concept is one of teacher and student. When we work with colleagues professionally abroad, it is critical to remember that if you give someone a fish, you feed them for a meal. If you teach someone to fish, you enable and empower them for a lifetime. So an important concept is one in which at all times visitors from both sides of the ocean are in fact both teacher and student, and that together is better. The goal is to create a win-win situation. And one of my favorite quotes related to that comes from Caleb Colton, who says, "Those who visit foreign nations but associate only with their own countrymen change their climate but not their customs. They see new meridians but the same men, and with heads as empty as their pockets, return home with traveled bodies but untraveled minds." Don't allow that to happen to you. Ensure that your mind is in fact a heavily traveled one, and one that is cognizant of cultural differences and cultural diversity and the rich rewards that one can glean from international collaboration. For additional information on this or any other programs, be sure to visit www.gedinfp.com. Be aware of what we have available to offer that can assist you as you pursue your international dreams. Thank you.